Thank you very much. It is a pleasure to be here and wrap up this symposium. I want to take us one step further and try to dig into the biology of this a little more and see how this test actually correlates with not just stenotic disease but also the burden of coronary disease overall and plaque burden. So I will show you three major points in the next 12 minutes or so. First is that peripheral gene expression as measured by this test actually significantly correlates with coronary plaque burden, both as measured by QCA-derived measurements as well as calcium scoring. Secondly, this test actually significantly predicts the presence of a positive calcium score. And thirdly, that this peripheral test actually can predict not only calcification but even, of course, obstructive disease. And in a multivariate analysis, actually, the test was independent while the calcium score was not. So all of us know the face of coronary disease, which is on the basis of atherosclerosis. That's really the disease that we're trying to prevent. So the idea here is that we have genetic predisposition for disease that is encoded in the DNA, which then interacts with the environment, and those interactions then are translated through gene expression, which is what we're measuring in this test. So the issue is that the clinical diagnosis, as was pointed out earlier, is currently a three-tiered approach. In patients with no previous CAD in whom there are symptoms suggestive of ischemia, we do some sort of clinical risk assessment, mostly by the Diamond-Forrester classification. Patients are low risk, then we do not do any further evaluation. If they're intermediate risk, then the patient gets some sort of non-invasive imaging. If that's positive, they go for invasive testing. And if the clinical risk assessment shows high risk, then the patients typically go directly to invasive angiography. So if we go back to this ischemic cascade, really the Diamond-Forrester approach only uses three of these issues: exertional angina, demand ischemia, and fixed stenosis. And the question is, can we go back earlier in this cascade through looking at gene expression, which should be a much earlier process in the dynamic process, and can that help us?